For as long as any of us can remember, taking medicine has meant one thing: swallowing a pill. But what if there's a better way? A much, much more efficient way? What if the future of medicine isn't about what you swallow, but about what's happening right inside your cheek? Today, we're going to unpack the incredible world of buccal drug delivery. But let's start with a question, just to get you thinking. When you take a pill, you probably assume 100% of that medicine goes right to work, right? Well, where does most of that active ingredient really go? The answer is kind of shocking, and it points to a huge problem with the way we've been doing things for forever. And that really gets us to the heart of it, the problem with pills. See, the journey a pill takes through your body is honestly a total gauntlet. It's a long, rough road from your mouth all the way to your bloodstream. And believe it or not, a whole lot of that medicine gets lost before it can do any good. And here's the main culprit. It's called the first pass effect. I want you to imagine your liver is like a super strict security checkpoint at an airport. When a drug you've swallowed gets there, the liver basically pats it down, inspects it, and ends up destroying a huge portion of it. It's just doing its job, filtering things out. But for medicine, it means a big chunk of the dose you took is gone before it ever even reaches your bloodstream.
So, if the stomach and the liver are the problem, what's the solution? Well, what if we could just avoid them entirely? I mean, what if we could build a direct superhighway for medicine to get straight into your circulation? No detours, no checkpoints.
And here it is. This is the big idea. It's called a Buccal drug delivery system, or BDDS for short. You place this little medicated film inside your cheek, and the medicine gets absorbed directly through that soft tissue, the buccal mucosa, straight into the massive network of blood vessels that are right there. It completely bypasses the digestive system and, you guessed it, completely sidesteps that liver checkpoint. So what does this actually mean for you? Well, the benefits are huge. First, you get improved bioavailability. It's a fancy term that just means more of the actual drug gets into your system to do its job. And because less is wasted, doctors can use lower doses, which leads right to point number 2, reduced side effects. And finally, since it's a direct route to your blood, you get a rapid onset of action. The medicine starts working way faster. This is a total game changer, especially for kids who can't swallow pills or for anyone who's too nauseous to keep medicine down. Okay, so you might be picturing just one thing, like a little piece of paper, but this technology is actually super versatile. It comes in a few different forms, and some of them might even look a little familiar. The most common are these thin, flexible patches and films. They just stick right to the inside of your cheek. They're surprisingly comfortable, you barely notice them. They're designed to dissolve slowly and release a very controlled, steady dose of medication over a specific amount of time. Then you've got lozenges. Yeah, just like a cough drop, but way more advanced. These are what we call bioadhesive lozenges, and they're made to dissolve really slowly. They're perfect for delivering things that need to work right there in the mouth, like a local anesthetic or an antimicrobial. And finally, you also have gels and other thick liquids. You can use these to just coat the inside of the cheek. Sometimes they carry the medicine, and other times they're just there to provide a protective, lubricating layer, kind of like an artificial saliva. Okay, so the big question: how does the drug actually get from that little film into your blood? It's all happening on a microscopic level, and there are basically 2 secret passages the drug molecules can take. They can either sneak between the cells or go straight through them. And this breaks it down perfectly. The first path, the paracellular route, is when the drug zips through the tiny spaces between the cells. This is the preferred route for drugs that love water, what scientists call hydrophilic drugs. The other path, the transcellular route, is for drugs that are fat-soluble or lipophilic. These guys are able to pass directly through the cell's outer wall, like a ghost passing through a barrier. So which highway the drug takes really just depends on what kind of molecule it is. All right, so we get what it is and how it works, but how do they actually make these things? Let's take a quick peek behind the curtain at how these medicated films are manufactured. The first method is called solvent casting. It's kind of like making fruit leather, actually. You take the drug and all the other ingredients and dissolve them into a liquid. Then you pour that solution out into a super thin layer and let it dry. As the liquid evaporates, what you're left with is a perfect, evenly medicated film. Next up, you've got hot melt extrusion. This one's a bit more industrial. You take all the ingredients, heat them up until they're a molten goo, and then you force that hot mixture through a specially shaped nozzle to form the film or tablet. And a third way is direct milling. This is more of a mechanical process. All the powders, the drug, and the other stuff are mixed and kneaded together, almost like a dough. Once it's a perfectly uniform mass, it just gets rolled out to the exact thickness they need. And of course, these films don't just roll off the assembly line and into a pharmacy. They go through a crazy amount of testing. I mean, they test for everything: thickness, hardness, how much it can bend without breaking, and most importantly, how well it actually sticks inside your cheek. It's all to make absolutely sure that what you're getting is safe, effective, and reliable. So when you put it all together, what does this mean for the future of medicine? Well, this isn't some far-off sci-fi idea. It has the potential to totally change how we treat a whole bunch of really common conditions right now. Just look at this list. We're talking about faster pain relief, more effective heart medications, nicotine delivery to help people quit smoking, even rapid-acting asthma treatments. But the real story here isn't just the what, it's the who. Think about a little kid with a high fever who just won't swallow medicine, or someone going through chemo who can't keep anything down. For those people, a simple film that just dissolves in their cheek isn't a convenience, it's a lifeline. It's a kinder, more effective way to deliver care. Look, if there's one thing to take away from all of this, it's this right here. Buccal drug delivery is, plain and simple, a smarter way to get medicine into the body. By taking the path of least resistance, it ends up being more direct, it works faster, and because you can often use lower doses, it's frequently a much safer option. Which kind of leaves us with one last big question to chew on. We've been relying on the simple, swallowable pill for over 150 years, but with innovations like this gaining traction, you really have to wonder, are we looking at a future where, for a lot of us, swallowing pills just becomes a thing of the past? A future where medicine is not just more effective, but also more accessible and, honestly, more humane for everyone? It's definitely something to think about.